my name is Trisha Rastogi, and my presentation is titled Disempowerment, Period Poverty in Today's World. A little introduction to me. As I said, my name is Trisha, and I'm an incoming senior at Blue Valley High School in Overland Park, Kansas, USA. Outside of being in the GHLC, I enjoy being involved in my community. I co-founded an initiative known as the Flow Forward Foundation, which I'll get into later, and I'm on the teen council for a local mental health nonprofit, Zero Reasons Why. In the future, I aspire to become a physician, and I hope to specialize in either neurology or radiology. So now let's get into the topic of this presentation, period poverty. 500 million people globally suffer from period poverty each month, according to the World Bank. It's one of the most pervasive yet neglected public health issues of the 21st century. So in this presentation, I'll dive into what period poverty is, elaborate on its potential implications, as well as discuss how we can work together to finally end period poverty. Period poverty can be broadly defined as a lack of access to menstrual products, usually because they're unaffordable, and comprehensive menstrual health education. It's a very multifaceted issue, and one of its major facets is period stigma. Stigma can consist of cultural taboos or widespread societal attitudes, but essentially it boils down to the fact that many believe menstruation is dirty, shameful, or disgusting. And unfortunately, this cultivates an environment in which people are hesitant to discuss menstruation, which also contributes to the proliferation of misinformation, leading to unhealthy and unhygienic period care practices. Another major facet of period poverty is WASH facilities, which the UN defines as water, sanitation, and hygiene facilities. If you menstruate, think of all the resources you might need in order to manage your period. That can be toilets, sinks, running water, disposal facilities, etc. This becomes increasingly more relevant as we realize the fact that menstruation does not stop for war, famine, supply chain disruptions, natural disasters, etc. Therefore, in order to finally eradicate period poverty, we must ensure widespread and equitable access to WASH facilities for all. Now, period poverty around the world is more likely to affect populations that are unhoused and low income. In the United States, there's been recent public discourse about the impact of period poverty on incarcerated populations, as well as the injustices that they face. One of the major things I wanted to dive into in this presentation is period poverty in schools. Menstruators my age, your age, and younger are having to miss school every month because they can't afford or access the products they need to manage menstruation. This is known as absenteeism, and it affects both mental and physical health. Attendance, academic performance, and grades all suffer, which leads to a decrease in confidence and an increase in stress. It also leads to an increase in vulnerability of dropping out of school, which can have potentially disastrous implications for economic empowerment going forward. Sometimes in schools without access, menstruators risk bleeding through their clothes, and there are physical health implications as well. Many menstruators with limited access to period products must stretch out their products, meaning using the products for longer than they're supposed to be used for. And this can risk reproductive tract infections as well. Clearly, period poverty impacts menstruators' ability to participate in their school and in their community. Now, many schools are trying to attack this issue by allowing for dispensers and free period products in schools. This becomes especially important as we consider the fact that the average age of menarche, or the average age of the first period, is decreasing, meaning that free period products should be more widely accessible. They are medical and hygienic necessities. There have also been legislative efforts around the world to combat this issue. Here in the United States, the state of Alabama recently proposed a grant program in which funding will be allocated and set aside for the provision of free menstrual products in Title I schools for grades 5 through 12. There's also been increased conversation about the importance of period-positive workplaces. Essentially, what period-positive workplaces are workplaces that ensure access to adequate wash facilities and free period products for menstruating employees. This has been empirically proven to increase employee productivity and reduce absenteeism. Clearly, measures taken to ensure period equity in both schools and workplaces are providing tangible benefits. Now, I also wanted to get into some of my personal efforts to end period poverty in my own community, and that starts with defining menstrual equity. Menstrual equity is the affordability, accessibility, and safety of menstrual products for all people, including laws and policies that acknowledge and consider menstruation. I co-founded an initiative known as the Flow Forward Foundation that fights for menstrual equity. And it's actually very special in regards to the GHLC because it was inspired by a GHLC member last year who was doing something very similar in her own community. Afterward, I watched the documentary titled Period, End of Sentence by the PAD Project. And that just gave me more insight into the scope of this issue and just how dire it is. To date, I've donated more than 14,000 products. And one lesson that I gleaned from this is that so many organizations and vulnerable populations rely on in-kind donations. And that's just a testament to how widespread and entrenched in our society this issue is. So we have to talk about how we can finally end the cycle. All menstruating people deserve to feel comfortable, clean, and dignified when managing menstruation. But at this point, it's being treated more as a privilege than the right that it is. We need concrete policy solutions targeting the systemic roots of period poverty. That means acknowledging that period poverty is a fundamentally intersectional issue. It intersects with racial, economic, and gender equity. Policy solutions can target the importance of adequate wash facilities, the high prices of menstrual products, discriminatory sales taxes, etc. And they should also focus on increasing access in public places, including schools, restrooms, and other public facilities. Finally, we also need to bridge the education gap. That means allowing menstruators to take charge of their cycles and also fighting for the destigmatization of periods. We have to have more productive community conversation around it, in addition to involving non-menstruating people, so that we can all work together to end the stigma. Ultimately, this is just one step in achieving gender equity. I also wanted to highlight the World Bank's policy recommendations, which are a multidimensional and holistic approach taken to ensuring period equity through three primary lenses, which are through policy, infrastructural development, and social change. These are my references, and these are my acknowledgements. I'd like to thank all the menstrual equity activists fighting to end period poverty, and I'd also like to thank the GHLC for giving me this opportunity to present. I'd like to thank you as well. Thank you so much for taking time to watch and listen to my presentation. And I'd love to discuss period poverty or menstrual equity with you, so you can reach out to me at my email here. Thank you.